Very much. Before we pick your closing remarks, I want to speak to Dr. in regards to cervical cancer that you mentioned, and cervical cancer, pregnancies, and COVID-19. I want to pick in that particular regard what should be very key for medical practitioners and inclusive of the patients that have to come for these services.
So cervical cancer screening, it's important. Cervical cancer is one of those cancers that can be prevented, actually. So primarily our sexual behavior. You have young girls engaging in sexual acts. They're still young, their cervix is still growing, so they're likely to pick the HPV that actually causes the cervical cancer. Then there are people having multiple sexual partners. Those are risks that are likely to give you the HPV. But now, past that, we can also pick changes very, very early, changes in the cervix. They can show, it can show us that, well, this cervix is changing towards cancer. It's not yet cancer, but it's on the way. So that's where cervical cancer screening comes in. Every woman, if you don't have any immunosuppression, I mean if you have HIV, diabetes, any of those things, every 3 years, once in 3 years, that's a very long time. You don't really have to frequent hospitals. Once in 3 years, go and have a pap smear or just have VIA done. Then if any of this is picked, then management can be started very early. Then in terms of pregnancies, when we tell people to attend antenatal care, it's not for fun. The reason people are supposed to go for antenatal care is, one, to pick out some of the issues that are likely to complicate your pregnancy. But also number two is to monitor the baby, because the baby is inside there and no one knows what is happening. But when you come to hospital, we're able to do a scan, we're able to listen to the heartbeat of the baby, we're able to do some tests, and then pick out some infections that are likely to affect the unborn baby, or when the baby is born later. So antenatal care is very important. Accessing care on time. If a doctor gives you an appointment, it's important to keep it. When you miss the appointment, then there's something you're going to miss. You might get a complication. Your baby can stop playing or moving and even die, and you do not know. Yet if you had come on time, that baby could have been saved. For COVID-19, vaccination, because COVID-19 is here. It's not going anywhere. It's a viral infection. So it's seasonal. We're going to keep having bouts of infections every year. So when you are vaccinated, then your body has a chance to fight, especially if you have comorbidities, if you're pregnant or you're planning to get pregnant. Kindly get vaccinated. Have all the 2 vaccines that are recommended. Get boosters, as Dr. Adele was saying. Make sure that your body is ready in case you get an infection. Yes.
Thank you very much, Dr. Ndozire Jr., who is a